Hi, welcome everyone, and thanks for joining us. This is the fourth workshop of a workshop series held by the Healthcare Consumers Association in the ACT and myself. If you're interested in any of the previous workshops that we've done, they're all on our YouTube page, as well as the YouTube channel from the Healthcare Consumers Association in the ACT. And we can supply the links if you're interested. So previous talks have been on just an introduction into research in general, then the involvement of healthcare consumers in research and what that might look like. Not last week, but about 2 weeks ago, we've talked about research ethics. And today it's all about academic publishing. But before we get started, I'm joining today from Ngunnawal country, and I'd like to acknowledge and celebrate the first Australians on whose traditional lands we meet, and pay my respects to any elders past and present, and any First Australian or Torres Strait Islanders who are with us today as well. Feel free to pop in the chat or into your name line where you're joining from today. And for those of you that don't know me, I'm Mary Dahm. I'm a senior research fellow here at the ANU Institute for Communication and Healthcare. And for the last 6 years, more than 6 years, I've facilitated consumer reference groups at 2 different universities. And I've also been a health consumer myself, just because I feel like if you see what it's like from the other side, you know which pitfalls to avoid. And as part of my academic role, I think I've started my PhD 14 years ago. So that's about the amount of academic publishing experience that I also have. I was one of the first ones back then at my university to do my PhD by publication, which especially in linguistics, was a bit of a novelty at that time, and at some universities still is a bit of a novelty. But regardless of that, I'm here to share with you today how we can go about all this in terms of academic publishing. And we're just going to start with a little short intro on why do we actually need it, and then getting more into sort of the details about what types of journals can you publish in, what are impact factors and why do you need to know about them? Also, what different types of things can you publish in journals? And then the nitty-gritty of what does the publication process actually look like? So this is where we're going today. Why do we need academic publishing? Well, it's really an important tool for promoting transparency, for advancing and sharing knowledge, and most importantly, I guess, for people involved, is that it improves the health outcomes for patients. And for researchers and health consumers alike, as well as healthcare professionals, it's really that staying up to date with the latest research and findings. Everyone can make informed decisions about health and well-being, which then gets to a bit of a tricky point if you think about who has access to things and how are academic findings reported and what difficulties might that bring. But that's sort of the idealist view behind why we publish, is to make life better, and to inform decision-making and to improve health and well-being. But I acknowledge that that might be a bit of an ideal that we aspire to, but not quite meet. So for health consumers, or from a health consumer perspective, academic publishing is really important because it provides access to the latest research findings and advances in healthcare. By reading academic publications, you can also gain a better understanding of the latest treatments and medications and medical procedures, as well as risks and benefits attached. Again, this should all come with an asterisk of if it's written in a way that you can read and if it's published somewhere where you can access it. Academic publications, like I said before as well, are also a good way for professionals and researchers to share knowledge and expertise within and across different fields, and they help to promote collaboration and innovation. Especially because you might not know who's working on a particular thing, and you see they're published on it, and you can reach out and say, oh, I'm working on a similar thing. Do you want to join forces? And by doing that, really, this is also what leads to the innovation that we need for better treatment options and healthcare outcomes. And the third thing, a bit more on another sort of playing field, is that academic publishing is really important to ensure that research and how it's put out there to the public is accurate and reliable. And that's sort of where probably there's a bit of a junction between academic publishing and the reporting of academic publishing in like the media, because they do not necessarily only reformulate what is in a scientific article, but they also recontextualize it, and it can sort of have ramifications for honesty or reliability. And usually it comes with really sensationalized headlines like eating a fry will kill you, or how you can't eat or drink coffee, or how you should drink coffee every day. And that's sort of where, for academic publishing, the quality assurance part comes in, because what is published in academic journal has undergone a strict peer review, and it's meeting strict publication criteria, so that it provides this level of quality assurance that is not necessarily found in other sources of healthcare information. So that's the first part of why are we doing it. Then let's look at what different type of academic journals are, and they have different audiences and functions. And there's also different ways to measure the impact of an academic publication. And we'll talk about why that might be important. So academic journal types. So first of all, the ones that probably all of you would know or think of are sort of the academic scholarly journals. So those are journals that are usually aimed at academic researchers and scholars. They typically contain articles that are original research or reviews or discussions about a particular topic in a particular academic field. And usually you can categorize them sort of what their focus and their scope and their audience is. So there are more general medical journals that you probably would have heard of, like the MJA, the Medical Journal of Australia, or the Lancet. And then there are more specialty journals that focus on specific fields, like oncology, for example, or neurology, or health communication. And I've gave some examples here. So you have qualitative health communication. And you also have one that is focused on patient experience, so PXJ, that stands for Patient Experience Journal. And both qualitative health communication and the Patient Experience Journal, there are open access journals, free open access journals, and I come to what that means in a little bit. So those are your scholarly academic journals. Then you have your professional and trade journals. So they're mostly aimed at professionals in a particular industry or field, and they typically have articles that provide practical information, news, or relevant information into that field. Some of them might be open, so anyone can access them. So for example, the Health Advocate is open, and the one that I put up here as well, this is from Avant, who's a medical indemnity company. Insurance, I mean, they are publicly available, but some are just sort of based on a subscription model that not everyone is privy to, because they're only able to subscribe if you're part of the particular craft group, so to speak. So there might be for journalists or a particular type of health professionals. So if you're a member of the Australian College for Emergency Medicine, that might be a craft or trade journal that is behind a paywall, so to speak, and that you only get to access when you're a member of that club. I'm sorry, there's someone with their mic on that I would like to mute themselves. Fixed it. Sorry about that. And then the third one, what you probably don't necessarily think of academic journal types, but I wanted to list here as well, because more and more researchers and academics publish in these type of magazines or websites. And probably the most common one that people know would be The Conversation. So they're magazines or websites that are aimed at a more general audience, and it contain like articles on a huge range of topics, including health or lifestyle or current events, and really sort of commentary from researchers or based on research, but written for the general public. So this is sort of where researchers can avoid this step of having the media sensationalize what they have found by writing sort of pieces that get picked up by the media themselves. And you've also already heard me talk about open access. So this is the second sort of flip side of the coin in terms of journal types, which regards to access. And it's really important, I feel, that health consumers know about the access aspects that regard access to publication and associated fees, because that will help them make informed decision where they will access research as readers, but also if they're ever involved in wanting to write their own articles or are part of an author team, where to publish their research. So open access journals allow anyone to access the article without a fee or a subscription. So they're just online, you can go, you can read and download them at your heart's content. This is really good for increasing reach and impact of the research, but usually it means that the researchers or the authors are responsible for covering the publication costs. And just to give you an insight, for one of the biggest academic journals that people know, Nature, if you want to publish something open access, you pay about $10,000 for an article to become open access. So you can see how that's quite restricted, especially for researchers that are in lower or middle income countries. Oftentimes there is exemptions for those countries, but for some journal articles, you will still end up being $3,000 to $5,000 out of pocket, or you have to pay it out of a grant. There are some free open access journals as well. And when I say free open access, I mean free to publish open access journals. And I mentioned qualitative health communication before and the patient experience journal, but they're quite rare still. Then you have paid access, which basically is you can access the journal's website. If you have some sort of affiliation with a university, you can access anything that the university has subscribed to, meaning its entire journals, not just individual articles. If you don't have the luxury or any affiliation, some local libraries or the National Library might be helpful in that respect. Or there are pay per article type arrangements where if there's a particular article you want to read and it's in a paid access journal, you have to pay between $30 and $100 for that article to be able to read it. There are hybrid journals, and there's sort of a mixture between both. So they offer both open access and paid articles, and the option is usually chosen by the researcher. That can be facilitated by whether they have access to funds to make something open access, whether the grants that they have that their research is based on requires them to publish something open access, or whatever other consideration might come into play with that. And then lastly, you have predatory journals, and they really prioritize profit over quality research. And they often engage in sort of deceptive practices, and I'll show you some on the next slide. Sort of falsely claiming rigorous peer review, listing researchers and academics as editors that aren't actually editing or have ever been asked for permission to be listed as an editor. And they're usually frowned upon in the academic community because they undermine the integrity of the publishing system, and they mislead readers and researchers and can also harm the career of authors unwittingly publishing in them. And this is quite the fluid space as well. There have always been sort of lists about predatory journals, but just recently one really, really large publisher called MDPI, that was considered to be a reputable journal, has been removed from some of the official lists in terms of them being a good journal, and is now classified as a predatory journal, even though people often published in that journal or in that range of journal that this publisher had, thinking it was reputable. So journals can change as well, depending on how well they do that process, how rigorous their peer review is, and so on. So I promised you I'll show you what those predatory journals do to attract readerships, publishers, authors. So there's really a couple of methods how they try to get you to publish there and generate the revenue. And usually they're paid or paid access. So you have to either pay to get, the researchers have to pay to publish there, even though that might be lower compared to other places where you might be publishing. But usually what they do is they send you unsolicited emails like this one. I just fished out of my junk that I got sent. Vanessa is inviting me to put something into their upcoming journal, which will be published on the 30th of April in 2163. So usually you can spot them straight away, like they are usually silly like that. They might also have false advertising about what their impact factor is, who's on the editorial board. They might also imitate legitimate journals in terms of what their name is or their logos, or there might just be slightly different names for the journal. We also said they have low publication fees often, which compared to legitimate journals are quite attractive for some authors, and they can be an indication of the poor quality control. Oftentimes, their peer review is really not rigorous. And I explain a bit more about peer review in a little bit, but they often have very, very short turnaround time. So peer review is when you submit an article and it then gets sent out to peers, so other researchers, to look and comment on it, whether it is rigorous and really good research or not. You can imagine that takes time, but for predatory journals, some of their peer review turnaround might be a couple of days or a week, which is quite telling, because let's face it, academics don't work that quick. And then they're also exploiting open access. So they often have open access models so the readers can access the articles for free, but they're also then attracting authors that are looking for a quick and easy way to publish their work, because this is a quick and easy to get your work out, but it's not in a reputable journal, what's considered a reputable journal. And your impact might not be as good as what you would hope, bringing us to impact factor. So impact factor is really the metric used to evaluate the relative importance and prestige of academic journals. It's a measure of the average number of citations that articles published in the particular journal have received within a year. So you might have published 100 articles, and the articles might have attracted 500 citations, and that is how your impact factor gets calculated. So you divide the number of old citations in the current year by the article of the number of articles published in the previous 2 years. So the higher your impact factor, the more prestigious people think that journal is. But impact factors are really not the only factor to be considered when you evaluate the quality of a journal or article, and other factors like the peer review process and the reputation of the editorial board are also important. So if your journal has a really low impact factor, but it has the leading people in your field on the editorial board, that can be another way to show that it's impactful. And then it comes to citations. So citations are usually the references that are at the end of a journal article. And that's how you get cited. So someone reads your article and says, oh yeah, I need to refer to that when I write my article. So it goes into their reference. And by going into the reference of a different journal, you get one citation. And citations serve several purposes. So they acknowledge the sources of idea and information used in your article or in someone else's article. They provide evidence for the claims that authors make in their writing, and they demonstrate scholarly impact and the influence of the work. So it's typically thought that the more citations an article has, the bigger its contribution to the field is. And really, this is high citation counts can indicate a significant contribution, but there's also flaws with that. If people build little teams that just keep citing each other or they keep citing themselves, so there are flaws in counting impact by just looking at citations. Here's other ways of looking at impact, and they sort of complement those traditional measures of impact factor and citation that we've just looked at. So the traditional measures do not really capture the full range, and you want to sort of reflect the changes that have occurred in the communication practices. Research articles are increasingly available online. They are shared in social media and blogs and other online forums. So altmetric, for example, that's the funny circle on the right, can give you a score for an article that sort of takes together, and if you've hit a lot of different avenues, so if you hit social media, newspaper, and TV, that ring that is now blue and red lights up like a rainbow. And really that sort of gives you an indication of how far reaching the publication was. And then you also have other metrics sort of from the journals themselves. So you can see here, I took a snippet of an article that I had that has been viewed 10,000 times, has been cited 9 times, has an altmetric score of 67, which puts it in the top 5 of all research output scored by altmetric, and it got 1 comment on the website of the journal that it was published on. So what can these other ways of measuring impact do? Well, they can help us really show where we made a difference. So it would also include things where your research has made it into public policy, where your research had made it into media and TV to increase awareness. And it also gives an idea of transparency and openness. So who can actually see this, and what are the relationships that a researcher might have with the broader community. And then the public engagement as well. So how often is this referenced in public forums or events, in conferences, in public lectures and policy briefings? I'm just going to check. There's some, I'm going to check into the chat every once in a while to see what there are questions. Yes, and there's open access has been very important for health consumers, and I agree, because how would you get access if you had to pay for any article you have to read? You'll be out of money very quickly. And then what about writing a book? Yes, it depends. Books I want to say, in traditional sort of healthcare, and when it comes to what treatment is good and what intervention brings the best outcomes, people don't do books. This is all handled in academic journals and journal articles because it needs to be quick and relatively free-flowing, whereas books are not as easily accessible, usually, or used to be, and too long in terms of processes in publication. So if you're really, really quick, from research to publication, you might hit it in 6 months. You'd never get a book published in 6 months. And where do we find this to write our articles? So usually you could try with the publisher. Usually the publishers have a little link on the side where you can see what the metrics are for your article. Or I think you can also just go into Altmetric itself and search for an article there. If you have a university affiliation, most universities also have a Altmetric portal of some sort where you can log in. And there's also other ways of, and I didn't put that in here because again, it's oftentimes university restricted. There's something called citation reports where you can also look up journals and look up what their impact factors are, but that's usually through a university access, or you need to sign up for it. And I'm not sure if you can sign up for it with a regular email address, to be honest. Good, moving on. Publication types. So we've talked about where we can publish. Now this is more about what we can publish. And really, it depends on what you want to achieve with the thing you're writing to say what type of publication you might write. So those are the big ones that most people would have heard about. So you have original articles. Original articles usually present new research findings or insights, and they're usually the most common type of academic publication. They're typically structured like you would expect a research article to be structured. So you have an abstract, introduction, method, section, results, discussion and conclusion. Depending on where you publish, there might also be a practical implications section. Then you have systematic reviews, and they summarize and critically evaluate existing research on a particular topic or research question. And they usually involve, not usually, they should always involve a thorough and comprehensive search of the literature. And they really use explicit methods to assess the quality of the studies that are included. So they have really strict search mechanisms that you need to publish as well. And you extract data and you analyze the data from a range of different studies that have been done on that topic. And then the third big one, I think, are commentaries. They're often opinion pieces. They give critical perspectives on either existing research, policy or practice, or something that is contentious or new or an innovation. They can also offer recommendations, and they're usually often used for sort of these new ideas in the field, because if there is not enough sort of evidence to back something up to publish it as an original article, but if people want to move the field ahead by publishing something about a new theme or issue or field of concern. Then you have case reports, and they often happen sort of for with the aim of highlighting a particular disease or a treatment or a clinical situation that might not be so common. They can be on one patient or a case series of patients, and they really just talk about sort of how this presented, how it was treated, what worked, just to give an idea of how this disease presents and what it does. Then you have editorials. They're, as the name says, usually written by the editors of a journal, and they summarize either the issue of the journal, or they offer their perspective on a particular topic or issue related to the field of study or a particular article in that journal as well. And then letters to the editor are responses that people send in, and they can be sort of short communications, again commenting or providing criticisms on an article that was previously published in that journal, or on the journal overall. So those are the big sort of types of publications that you would usually come across. And now we're going to have a look at what you think it actually what type of ones you have been involved in or know people that have been involved in them. And I just switch my screen to go there. So you can scan the little QR code, or you just go on Slido and type in the number that's on the screen. Get you there. Yeah, so what academic publication types do you know? Have you been involved in? Have you read? I just want to see if there's anything else that we haven't covered in the slides that I just showed you. Ah, podcasts, yes. Social media posts. Consumer guides, yes. Keep them coming. You can put more than one in. So people are involved in a range of things. Podcast is an interesting one. I think that sort of is slowly being recognized as a good output for people for their research as well. Often medical journals now have a lot of podcasts that they run themselves. A lot of people have been involved with journals, conference documents, also important. You might have been part of a research team and have published an abstract somewhere. You might even not know that you're an author, because if you're part of a conference team, part of an author team or a research team, and they have published an abstract for a conference, depending on what field they were in, those abstracts also get published. Reports, that's a big one. Yeah, see, I forgot about that one. Thanks for putting that in. Reports are really interesting because oftentimes reports can or cannot be published openly. So they might sit on some researchers or research institutes' website, or they might not. So they can or cannot be publicly available. Submissions to Parliament, very important. Lots of researchers and lots of health consumers putting in submissions to Parliament, providing evidence there. I love how many different things you're coming up with. So lots of more practical, policy-oriented things are coming out now. Government newsletters, Parliament submission, annual reports. Yes, also very interesting. Annual reports of any healthcare organization, and what the involvement of consumers can be in for them. Great. So that will help me the next time I do this, that I also potentially need to include a section on policy and outside of academia publishing. If anyone wants to help me with that in the future, please put your hand up. And people have put social media posts and Twitter in here as well, which I just want to acknowledge as actually being quite important. Not sure how this will go now that the Twitter algorithms are changing, I feel like, every day, and not really sure who can see what anymore, but it is often a good source of finding new and leading publications in your field if you follow the right people. But you can also achieve similar things by following newsletters of journals or newsletters from particular organizations. For example, the Australian Commission for Health, the Australian Commission for Safety and Quality in Healthcare, they have a newsletter on the radar if anyone wants to look that up, that summarizes lots of publications that come out in terms of patient safety in the last span of a week. I think that's published weekly, that newsletter. Great. I love this selection here. Thanks for sharing that with me. And let me go back to the slides. See if I can switch them. Yeah. So here is an example of a original article that I've written with consumer co-authors. And like we said, there are typically the most common type of academic publication. Here, the consumer representatives were actually CEOs of a consumer advocacy group. But I'll give you some more examples for actual consumers being involved later. So typically they're reporting on empirical studies, so quantitative experiments or qualitative interview or mixed message research. I've talked about sort of what kind of format they have, which is often the same, and you can get quite used to it. If you really just want the gist of it, you read the abstract. If you want the nitty-gritty of how they did it, you read the methods, but usually people are mostly interested in the results and the discussion sections. And then usually they're between 4,000 and 6,000 words, depending on where you publish them. Then here's a systematic review. They, like I said, they summarize and critically evaluate research studies on a particular topic. This is one where we had a consumer involved as well. That was Maureen, here listed as one of the co-authors. Maureen I've worked with across 2 consumer reference groups at 2 different universities. And this is an example of some help consumers being involved from start to finish. Jocelyn as well also participated here in a consumer capacity. And they were really involved in setting out and nodding out the research questions that we've asked. They were involved in interpretation of the findings that we had and in discussing. So they really were part of that research team for this project. They're usually common in evidence-based medicine. So they're used to evaluate the effectiveness of interventions to identify risk factors for diseases or to assess the quality of existing research. So if you think of what's something that is a bit controversial, I heard recently, does vitamin D exposure really help reduce the number of fractures in the elderly? And it doesn't apparently, but it's still sort of promoted as such. So there's often also systematic reviews can help to sort of break down what has become the normalized treatment and to check whether that really actually helps or not. And if you write some of those, it's really important because they are really, really structured in how they have to be conducted and how they have to be reported. So there's the PRISMA guidelines that you can see referred here on the screen. And there's a lot of training available for that. There's a specific Cochrane training module that is free. Not all of the Cochrane modules are for free, but the one on involving people, involving consumers in systematic reviews, that is publicly available and free if you want to check it out. At the end of the slides, and I think as Shavana has PDF to send out as handouts as well, there are references with links to all of the things that I reference in here. So this is what systematic review looks like and what you have to take into consideration when you want to participate in one. And then just another look at another one. Here's a commentary. Again, this was bringing together 3 authors from 3 different fields. So you had Maureen, who is a health consumer, Carmel, who is a clinician, and myself as a health consumer researcher and linguist and health communication researcher. And we got together and really for this one, it was Maureen who started it. And I'm sure she won't mind me telling the story. Maureen was actually studying and doing her Master of Public Health, and she said, "Hey, I've wrote this assignment on patients and being listened to and cognitive bias. Can you help me sort of do something with it. And I said, yeah, sure, show it to me and I'll see what we can do it. And what we actually ended up doing was sort of melding her assignment with a conference presentation, a keynote presentation that I had given on listening and communication, interpersonal communication in diagnostic errors. And it fit really well, and really had Maureen's experience in there of not being heard. It had her unique experience of being an Edison's patient who has been in a lot of life-threatening and life or death situations, and how that related to cognitive biases and faulty thinking patterns and lapses in diagnosis. And it worked really well and was really well received by the journal that we sent it to, even though it was not the first journal we sent it to. The first one did not get it at all. And that's something that you have to be sort of comfortable with as well in terms of publishing. Now, how do you actually do it? So, well, you got to start somewhere, usually selecting a topic and actually doing a research. And then you get to writing. Usually what you should do before, well, you should write while you're doing it. So you want to maybe keep a coding journal or thoughts about, so that you know for your methods section who did what and when and how and who collected data and who was involved in what. So you have a record of that. But usually I would recommend not starting to write before you've actually selected a journal. And I have some examples of where you can turn to select a journal in the next slide. So really why that is helpful is because you then know, you can check, have they published stuff like that before? Maybe, yes, they've published 10 years ago, or maybe, yes, they published 5 in the last 2 years. So is the market for that journal oversaturated or undersaturated? Do they look like they're not publishing anything like the thing you want to write at all? Or do they think like they publish it regularly enough for you to squeeze in? It also gives you a model. So if you're writing like a qualitative journal that's based on interviews and you're writing that for a more quantitative geared journal, you can look at the qualitative stuff that they have published, you can look how that is structured, and you can try to emulate the structure, and it's going to make your life so much easier. Then for the actual writing of the manuscript, you want to write that in a clear and concise manner. You want to follow what the formatting guidelines are, which are listed in number 5. Each journal that you target might have a particular journal style and how it wants to be formatted and how it needs to be structured, how the references need to be done. There are some journals now coming on or changing to have free-form submission, which is a godsend for researchers, because you can just write it in whatever way you want. Not whatever way, it still needs to be structured, but it does not necessarily have to conform to a particular type of formatting for a particular journal, and you only have to format it after it's been accepted. Then health consumers can really be involved in being a co-author for anything that they've been involved in. And you need to accurately list institutional affiliations and disclose any conflicts of interest in writing that. If anyone's interested in sort of a step-by-step guide on how to actually write a manuscript, I've put a reference here and a link that you can access as well. And then you submit it. So usually that's done via an online portal. All authors that are listed as an author need to sign off on the final version that is submitted, as well as before it's published. Usually at that step of submitting, you also need to select whether you want this as an open access. If it's a hybrid journal, do you want this to be open access or only paid? And you need to be careful. And the reason why I'm stressing this formatting stuff so much is because it's the bane of our existence sometimes. Sometimes you get it back because you do not have the right formatting, as in, oh my God, your headings are not bolded. Please revise and send it back. They won't even look or send it out for review until you have every T crossed and I dotted. So that can be quite annoying for for a researcher to get it actually to the point where someone will actually look at it. The other things to consider when you submit something is usually you need to write a cover letter. A cover letter is basically just a short formal thing that says, here's our manuscript, thanks for considering it, here's why we think it's really important to be published in your journal, and to assure the editors as well that it's not been published elsewhere or that it's not under consideration elsewhere. Which is important because if you think about the peer review process, can be quite lengthy. So people might think, oh, I just submitted somewhere at the same, like at different places at the same time, but that's not a strategy that is looked upon friendly in academia. So those are the first steps. And I promised you here are some tools that you can have and that can help you figure out where you might want to send an article. So the first one's called JANE, and JANE is an abbreviation for Journal Name Estimator. And what you can do there is you can put in your abstract or the title of the journal article that you're writing. And so this one is actually, the picture on the screen is actually from Journal Guide. So you put in your title or your abstract and it spits you out, where things like that have been published before, what the impact factors are, how long they usually take, and you can have a look at what they looked like. And there's a bunch of them for all the different publishers that you can have. Some universities nowadays, if you have affiliation with the university, they have what's called a read and publish agreement, where they pay to read articles in a journal. And at the same time, the payment that they make for that covers open access fees for authors that are based at that same institution. So if I wanted to, for example, I think we have one with Wiley and Elsevier here at ANU, if I wanted to publish something in Elsevier and have it open access and not pay, or if I wanted to publish something and I don't have money to make it open access, I might want to focus on publishers that have these agreements. So Elsevier, I could go and say, yes, if I get into an Elsevier journal, it will be published open access and I don't have to worry about paying for it. So those are some tools that might come in handy if you ever want to publish something and want to find a journal where you publish. You can also do it the old-fashioned way. If you've written it or you know who your main references are, the main people that you cite, you can look at where they have published and then go from there. So you'll see there are patterns. A lot of people, for example, if you looked at this, a lot of people you might have cited have published in nephrology, dialysis, and transplantation. You might look at that journal to publish in. So that's how you find things. Now, this is an important one. What do you think, which aspects of involvement in a research project actually warrant you to become a named author? And I'm going to switch to the Slido again. And that one I'm really interested in. Check. So I think I need to close one and open the other one. Just one moment. Needs to remember who I am. So what aspects of involvement in a research project do you think warrant to be a named author? Here we go. So what is a substantial contribution, and where, in what part of the process are you thinking of? Any level, so any touch points you might have had? Good. Anything, important idea? Conception, very important, yes. What else do we get? A supervisor, or student, or researcher. You give insights, you've been involved in the analysis or the writing, you're the writer. So you can see how we're slowly getting to the different parts of a giving a smack to an academic. Is that meant to be saying smack or snack? Being part of the project. So we have conception, analysis, writing, we have supervision, and I think this shows you that it's not just the writing bit. And that might mean that you are or maybe entitled to be an author in a lot more things or products and publications than you think you might be. And there are actual guidelines for this. So the authorship criteria for most sort of medical journals come from the International Committee of Medical Journal and Editors. And they say it's a substantial contribution to the conception or design of the work, or, and not and, or the acquisition, analysis, or interpretation of the data. So if you've been involved in conceptualizing an idea, you do not necessarily have to be involved in either getting the data, analyzing, or interpreting the data. If you haven't been involved in conceptualizing the idea, but you have been involved in getting the data or interpreting the data, you still fit that first criteria. Then drafting the work, this is the actual writing bit, or revising it critically. So that means one person can write the entire article and then sends it to all the other people that have either been involved in conception or acquisition, analysis, interpretation, or both. And they need to critically revise it. So critically revise is not just sort of, here's a typo, there's a typo. It's more like, have you thought about this? What about this interpretation? What about including that in the discussion? So that's critical revision. And then you need to approve the final version. And you need to be in agreement that you're accountable for all the aspects of that paper, which might be critical for some. And then you have author contribution statements that can look like this one here on the screen, where it says all authors were involved in conceptualization, then who drafted the article. That's the commentary with Maureen, where this contribution statement comes from, who reviewed, and then we all approved. So this is what that looks like. It's just really helpful to know where you might be already entitled to be included as an author. So then you have peer review. This is what happens after you've submitted. And there are different ways of doing peer review. And there's different sort of pros and cons about it. They have their strengths and weaknesses. And journals can choose to use different types of the review depending on what their goals or priorities are. So if you want to make it really, really equitable for everyone, you probably choose the one in the middle that's double blind, where the reviewers and the authors don't know who each other are. Single blind is a bit tricky because the reviewers know who wrote the thing, but the authors don't know who the reviewers are. And then there's open, which again depends on how you view and what you want to get out of it. It is intended to increase accountability and transparency, but you can also see how that might be tricky if a hotshot or someone who's seen as a hotshot in their field is publishing something, and a more junior person is getting to do the review, and they don't feel like they can openly criticize this person. So double blind really is as equitable as it can be. I think it really is helping to reduce potential biases, because if you know who the author are, where they work, or what their reputation is, that might color how you write their work. So consumers now getting increasingly involved in peer review. So it's gaining in popularity as a way to ensure that the research is relevant and meaningful to the people who will ultimately benefit from it. So they're also known as sort of patient or public reviewers, and they have personal experience usually with the health condition being studies, or they're representing patient or consumer advocacy group. And they have been invited to review for academic journals. Some journals actually have established programs to recruit and train consumers. So for example, the BMJ is listed here, or the Cochrane. And there's other journals as well that use them. The Patient Experience Journal, for example, that I mentioned before, has a huge bank of journal reviewers that are patients and consumers as well. For most journals, seriously, you can just go onto their website and sign up as a reviewer if you are keen to review for them. Some of them might want to have some credentials, and you might have to have a bit of back and forth with them, but really it's not a difficult process to get involved in that. And they're always looking for reviewers, especially now. So what happens then? What's the outcomes? So you can either get a desk reject, which is a lovely euphemism for when the editor gets your submission, looks at it once on their desk, and then sort of flips it off the desk, as in sends it straight back and says, this is not suitable for our journal, please send it somewhere else. I have never gotten an outright acceptance, but I've heard they exist. Usually feedback comes back with either a minor or a major revision. So minor is usually sort of accepting, please change these little bits, and the editor might look at it again. Really minor revisions and edits. Major revisions really usually can go in line with revise and resubmit, where there's major things that need to be done to improve the quality, and the editors can decide whether they want to accept them straight away, or if they want to send them out for peer review again. Or you can also then get a rejection after it's been reviewed, where they say, this is not suitable, please don't send it again, send it somewhere else. So those are your options. And what do you do after you got this back? Well, you revise the manuscript based on the feedback that you got, you make changes, and you prepare a response letter, which I'll show you in a second. And then you, if it gets accepted after you've done your revisions, you get a proof back that you need, that is usually typeset and looks like what the actual published article will look like. And you need to prove that, so that any typos or anything that actually get published are your fault. And then the manuscript gets published. In terms of revising something based on the feedback in the manuscript, really you write often a response letter. Here's some examples of what they might look like. I do them mostly in table format, where you provide a short summary of the changes and then have a point-by-point response to what the reviewers commented on. So they might have said number 3, provide this, add that, and I said, yes, we've added the following thing, here's what it looks like now. The important thing I want to stress here, though, is that you don't have to do everything that the reviewers want. You can disagree with them, like I've done here in this example, where I sort of said, yeah, that's well and good, but our focus was somewhere else. Really keeping in mind that oftentimes reviewers really just want you to have the best possible publication that you can have, and that's where their feedback comes from. And then ultimately the decision to accept or reject comes from the editor. And if they are satisfied with how you responded to the reviewers' comments, that sort of, you don't have to think about whether you're stepping on reviewers' toes or not. So this is what response letters can look like. And here we are, already out of time. I hope you got something out of this. I'm happy to answer any other questions that you might have. If you send them to Shavana via email when she sends out the documentation that comes with that, but I really appreciate if you could take the time, scan that cute little dinosaur QR code on here and give some feedback on this part of the workshop, not on this part, on the workshop, which is part of the series. So we know what we can change when we run it again. Thank you so much for your time, and I'll let you go. And
thank you.